Welcome to Guide 7 in our Wǔ Yùn Liù Qì series. Today we are looking at one of the most important diagnostic frameworks in all of classical Chinese medicine, the 19 disease mechanism. These 19 statements come directly from Sù Wèn Chapter 74, the same chapter that sits at the heart of Wǔ Yùn Liù Qì. What makes them so powerful is this. They don't just tell you what symptoms a patient has, they tell you why those symptoms exist at the root level. By the end of this lecture, you will be able to look at any presentation symptom and immediately ask the right diagnostic question. Which of these 19 mechanisms is driving this? So what exactly are the 19 disease mechanisms? To understand that, we need to go back to the Huang Jing Sù Wèn, the Yellow Emperor's classic of medicine. In Chapter 74, the Yellow Emperor Huang asked his physician Ch.74, I would like to hear about disease mechanisms. And Ch.74's answer is the 19th statement we are about to go through. Now here is the foundational principle I want you to hold on to. Symptoms are not the disease. Symptoms are manifestations. They are the body's way of expressing deeper pathological process that's happening underneath. The 19 mechanisms are the bridge between what you see and what actually happening at the root level. Each statement follows a precise grammatical formula, and that formula is what we are looking at on the next slide. Every single one of the 19 mechanisms follow the same structure. In classical Chinese, it's written as 诸皆属有. Let me break down for you. The character 诸 means all or every case of. The phrase 皆属有 means without exceptions, belong to. And then the root cause is a name at the end. So a typical mechanism reads like this. 诸风调眩皆属有肝. All disease with wind causing swaying and dizziness, without the exception, belong to the liver. Notice what this is doing. It's not saying that every case of dizziness is a liver condition in the full pattern sense. It's just saying when you see swaying and dizziness, start with the liver. The liver is the root organ to investigate first. This is the logic of the Bìng Jī, the disease mechanisms. It points you in the right direction before you dive onto pattern differentiation. The 19 mechanisms are grouped into 6 pathogenic categories. Each category responds to one of the 6 climatic qi, Liu Qi, and maps to the 5-phase element and its associated organ system. Let's go through them one by one. First, Fēng, wind. Wind belongs to Mu, wood, and the liver and the gallbladder. Wind has the quality of movement and upward rising. There are 2 wind mechanisms, number 1 and the number 14. Second, Han, cold. Cold belongs to Shui, water, and the kidney and bladder. Cold's quality is a contraction and congealing. There are 2 cold mechanisms, number 2 and the number 18. Third, Qi. This category maps to Jing, metal, and the lung and the large intestine. Qi mechanism involve blockage and rebellion. There are 3 Qi mechanisms, number 3, 7, and 8. Fourth, Shu, dampness. Damp belong to Tu, earth, and the spleen and stomach. The quality is heaviness and obstruction. There are two damp mechanisms, numbers 4 and 10. Now here's the one to pay attention to. Fire, fifth the fire, Huo. Fire maps to the heart, triple burner, pericardium. Its quality is upward and blazing, disturbance of the Shen. There are 6 fire mechanisms, number 5, 6, 9, 11, 13, and 16. 6. Re, heat. Heat also relates to fire, but specifically to the stomach and the large intestine. Heat tended to expand and cause putrefactions. There are 4 heat mechanisms, number 12, 15, 17, and 19. So if you add a fire and the heat together, that's 9 out of 19 mechanisms, almost a half. Fire and heat dominate this framework, and as we'll see when you connect this to Wǔ Yùn Liù Qì, that distribution has a profound clinical meaning. This slide gives you the complete quick reference table for all 19 mechanisms. I recommend using this as a study tool or clinical reference card. The color coding tells you the category at a glance. Green for wind, blue for cold, gold 10 for qi, brown for damp, red for fire, and orange for heat. Let me read through each one quickly so you can get a feel for the full picture. Number 1, Fēng, Sù Wèn, and the dizziness, liver. Number 2, Yin, contraction and pulling, kidney. Number 3, Qi, Fan Yu, chest pressure and blocked qi, lung. Number 4, Zhong, swelling and fullness, spleen. Number 5, Mao Qi, heat with confusion and spasm, fire and heart. Number 6, Tong, Yang Chuang, pain, itch and sores, heart and fire. Number 7, Jue, Xie, recession, retention or outflow, low burner. Number 8, Wei Chuan or atrophy, panting and vomiting, upper burner. Number 9, Jing Li, clenched jaw and shivering, fire. Number 10, Jing Xiangqiang, tetany and stiff neck, dampness. Number 11, Ni Chongshan, cheek up, counterflow rushing upward, fire. Number 12, Zhang Fu Da, abdominal distension, heat. Number 13, Zhao Huang Yue, mania and overexcitement, fire. Number 14, Bao Qiang Zhi, sudden rigidity, wind. Number 15, Bìng Jī, drum-like resonance, heat. Number 16, Bìng Zhōng, full swelling, pain and shock, fire. Number 17, Fan Li, contortions and turbid fluid, heat. Number 18, Bìng Ye, Qing, clear cold watery fluid, cold. Number 19, Suan, vomiting acid and sudden diarrhea, heat. In the following slide, we go through each category in detail with the clinical signs and the treatment protocols. Now let's look at the two wind mechanisms, number 1 and 14. Wind in classical Chinese medicine is the pathogenic qi of wood. It has the qualities of movement, rapid change, and upward rising tendency. And its primary organ association is the liver. Mechanism number 1, it reads, all diseases with the wind causing swaying and dizziness belong to liver. The mechanism here is that this wind is the qi of wood, and the liver governs the sinews and the tendons. When liver blood is deficient, internal wind arises. The internal wind then causes a tremor, swaying, and upward rushing yang. Clinically, you're looking for tremors, dizziness, vertigo, tinnitus, numbness, convulsions, headaches, eye disorders, and emotional irritability. For treatment, classic acupuncture points include liver 3, liver 8, gallbladder 20, gallbladder 34, du 20, and spleen 6. Herbal formulas include Tianma Guo Teng Yin and Zhenggan Shifeng Tang. Now, mechanism number 14 reads, all cases of a sudden rigidity belongs to wind. The key word here is bao, sudden. Wind is characterized by rapid onset and rapid change. So anytime you see sudden spasm, sudden rigidity, sudden onset of paralysis, think wind, think liver. Clinically, sudden muscle spasms and the rigidity of his tonus, trismus, so locked jaw, sudden hemiplegia, tetanic convulsions. Treatment, liver 3, liver 8, gallbladder 20, du 16, du 14, spleen 6. Herbs, Lingjiao Guo Teng Tang and Zhenggan Shifeng Tang. Now we move to the two cold mechanism, number 2 and 18. Cold is the pathogenic qi of the water. Its qualities are contractions, congealing, and stopping movement. Its primary organ association is the kidney. Mechanism number 2. All disease with cold causing contraction and pulling in belong to kidneys. The mechanisms, cold is the qi of water. The kidneys store yang qi, and the yang qi is the root of all bodily warmth. When kidney yang is deficient, cold penetrates into the body, causing contraction and tightening of the sinew and the blood vessels. Clinically, cold limbs, muscle contractions, cramping, pulling sensations. Lower back stiffness, joint pain that worsens in cold weather. Urinary disorders, fears and anxiety, and reproductive weakness. Treatment points, kidney 3, bladder 23, brain 4, du 4, stomach 36, spleen 6. Key formulas, Yu Gui Wan, Sini Tang, herbs like Fu Zhi, Gui Zhi, Du Zhong, Shu Duan, to warm kidney yang and unblock the channels. Now mechanism number 18. All diseases of watery fluid being extremely clear and cold belong to cold. This is one of the most clinically useful diagnostic principles in the entire systems. It teaches us to look at the quality of the patient's bodily fluid. When fluids are clear, copious, cold, thin, and odorless, that is the sign of cold. When fluids are turbid, yellow, thick, or foul-smelling, that points toward heat. Clinically, for cold mechanism 18, clear copious cold urine, clear watery vaginal discharge, clear watery sputum or nasal discharge, watery stools with undigested food, cold limbs, pale complexions. Treatment: kidney 3, ren 4, du 4, bladder 23, stomach 36, spleen 6. Formulas: Jing Shen Qi Wan and Zhen Wu Tang. Herbs like Fu Zhi, Rou Gei, Gan Jiang to warm yang and transform fluid. Now the 3 Qi mechanisms, number 3, 7, and 8. The Qi category maps to Jing metal and primarily the lung. But this category also includes the upper vana, Xiangjiao, and the lower vana, Xiaojiao. Mechanism number 3. All disease with the damped up qi resulting in the chest pressure belong to the lung. The lung governs the qi and regulates its descent and dispersion. When lung qi fails to descend properly, qi accumulates in the chest, creating pressure, oppression, and fullness. Clinically, chest tightness, oppression, shortness of breath, cough with difficult expectorations, asthma, and interestingly, constipation because the lung qi failed to descend to communicate with the large intestine. And grief and sadness are associated with the lung in the emotional tone. Treatments: lung 7, lung 9, pericardium 6, ren 17, stomach 40, bladder 13. Formulas: Xuan Fei Hua Tan Tang and Su Zhi Jiang Qi Tang. Now mechanism number 7. All recession disease with hardening or outflow belong to the lower body. This is about the lower vana, which governs the storage and the discharge of waste and fluid. When lower vana qi is disturbed, we see one of 2 extremes. Either it cannot discharge, retentions, or it cannot contain, xie, uncontrolled outflow. Clinically, Jue syndrome, where the cold or heat rushes to the extremities or causes the fainting. Urinary retention or incontinence, constipation or diarrhea without control, prolapse, seminal emissions, and uterine disorders. Mechanism number 8. All cases of lameness with panting and vomiting belong to the upper body. The upper vana Xiangjiao governs the distribution of wei qi and the descent of lung and stomach qi. When upper vana qi rebels upward or fails to nourish the body, we see Wei syndrome, muscle atrophy and weakness, panting and breathlessness, nausea and vomiting, and upward counterflow of stomach qi. Formula: Sha-shen Mai Dong Tang. It's for lung atrophy. Xuan Fu Dai Zhe Tang for rebellious stomach qi. Now the 2 damp mechanism number 4 and the number 10. Damp is a pathogenic qi of 2 earth. Its qualities are heaviness, obstruction, and turbidity. And it's the spleen that is most vulnerable to damp pathology. There are famous sayings in Chinese medicine. Spleen detests dampness. Mechanism number 4. All diseases with the dampness causing swelling and fullness belong to the spleen. The spleen's primary function is to transform and transport fluid. When spleen qi is deficient, the dampness accumulates. The dampness then creates swelling, fullness, and edema throughout the body. Clinically, edema, abdominal distension and fullness, heavy limbs, poor digestion, loose stools, fatigue, cloudy thinking, weight gaining, and skin condition with oozing or weeping. These are all classical presentations of spleen damp deficiency. Treatment: spleen 3, spleen 6, spleen 9, stomach 36, Ren 12, bladder 20. Formulas: Shenling Baizhu San and Wu Ling San. Herbs: Baizhu, Fuling, Yi Ren, Zhi, to strengthen the spleen and drain the dampness. Now, mechanism number 10. All cases of tetany and stiff neck belong to dampness. This one surprises many students. We usually associate neck rigidity and tetany with wind or wind cold. But here is the Sù Wèn tells us, look for damp. The mechanisms: dampness obstruct the channels and the sinews, preventing the smooth flow of qi and blood. When damp combines with the wind cold, it causes the tetany and the rigidity, especially of the neck and the upper body. Neck stiffness and the rigidity of its tonus, the spasm that causes the body to arch backward. Tetany with heavy limbs, stiff joint that worsen in damp weather. Treatment: gallbladder 20, bladder 10 to 14, spleen 9, stomach 40, bladder 20. Formulas: Jianghuo, Sheng Shi Tang, and Zhuan Bi Tang. Now we will enter the fire category. Fire has 6 mechanisms that the most of any category, which tell us immediately that fire pathology is central to classical TCM diagnosis. In this slide, we are covering the first 3 fire mechanisms, number 5, 6, and 9. Number 5. All diseases which heat causing pressure and spasm belong to fire, and specifically to the heart. The heart governs the mind, the shen. When fire blazes upward to the heart, it disturbs the shen. That disturbance causes mental confusion, clouding of consciousness, and spasms from heat stirring up internal wind. Clinically, mental confusion, clouded consciousness, convulsions, and spasms from heat, high fever with delirium, palpitations, insomnia, restlessness, and agitations, mouth and tongue sores. Treatments: heart 7, pericardium 6, large intestine 11, do 14, spleen 6, kidney 6. Formulas: Huang Nian Jie Tang and New Huang Qing Xin Wan. Mechanism number 6. All pain diseases with itch and soreness belong to the heart, which is fire. This one is one of the most clinically applied mechanisms in dermatology. In classical TCM, the heart governs all pain through its role in blood circulations. Fire generates soreness and skin lesions. So any condition that is painful, itching, and has a separating or inflammatory quality has a fire or heat element at its root. Clinically, skin sores and ulcers, carbuncles, and abscesses, itching and burning skin conditions, inflammatory skin disease, and painful wounds that are hard to touch. Treatment: heart 8, pericardium 8, large intestine 11, spleen 10, bladder 17, bladder 15. Herbs: Jininhua, Liancha, Pugongyin, Jihua Diding. Now, mechanism number 9 is one of the most important in the entire system. It introduces a concept that challenges our intuition. All cases of clenched teeth, chattering, and shivering, as if the spirit guard were lost, belong to fire. Wait, clenched teeth and shivering from fire. This is the concept of the Zheng Re Jia Han, true heat and the false heat. When heat is so extreme, so intense, it can cause the sinew to go into spasm, or it can exhaust the yin to the point where a false cold appears at the surface, while the inner state remains intensely hot. This is why in clinical practice you can have a patient with a high fever who present as cold and shivering, and the mistake is to treat them as a cold pattern. The Bìng Jī tell you, look underneath, check for the true heat. Treatment: do 14, large intestine 11, pericardium 6, heart 7, liver 3. Formulas: Bai Hu Tang for heat with a false cold, Lin Jia Guo Teng Tang for heat stirring wind. Continuing with the fire mechanisms 11, 13, and 16. Mechanism number 11. All cases of qi counter movement rushing upward belong to fire. Fire has a fundamental ascending nature. When fire blazes in the heart or in the liver, or when stomach fire reverses upward, qi rushes in count flow, moving up when it should be descending. Clinically, hiccup and belching, vomiting, and acid regurgitations. Nosebleed, hemoptysis, so coughing blood, headache with flushing to the face, and the palpitation with the chest heat. Ding Shang Shi Di Tang is sometimes cited here, but be careful that formula is for cold type hiccup, not fire type. For fire-driven counterflow, use Zhu Ru Wen Dan Tang and Huang to clear and descend the stomach fire. Mechanism number 13. All cases of overexcitement and jumping in craziness belong to fire. When fire blazes upward and disturbs the heart shen, it can cause mania, extreme agitations, and a complete loss of rational behavior. This includes conditions we might recognize today as acute mania, or severe agitation from high fever. Clinically, mania, overexcitement, restlessness, climbing and running about, classic manic behavior, incoherent speech, shouting, insomnia from extreme heat. Treatment: dose 26, pericardium 7, heart 7, large intestine 11, spleen 6, bladder 15. Herbs: Sheng Di, Mudan Pi, Lian Zhi Xin to cool the blood and clear the heart fire. Mechanism number 16. All disease with full swelling, pain, soreness, and shock belong to fire. Fire causes blood to move recklessly. It stirs the blood out of its vessels. This creates swelling and accumulations. The shock and the fright pattern here reflect hot fire disturbing the shen so intensely that the patient is startled, fearful, or in shock. Clinically, hot, painful swelling of the face or body, soreness and aching with the heat sensations, sudden shock and fright, sudden startling, hot skin lesions with the swelling. Herbs, 金银花、连翘、直或地定。Now, the 4 heat mechanisms, number 12, 15, 17, and 19. Remember, fire and heat are related, but distinct. Fire is more dynamic, more ascending, and primarily affects heart and shen. Heat is more diffuse, tends to accumulate in the yang organs. Yang means stomach and the large intestine. And its main effects are expansion and putrefactions. Mechanism number 12. All cases of distensions and abdominal enlargement belong to heat. Heat accumulates in the yang ming channel, causing qi and blood stagnation in the bowels. The bowels fail to descend, and the result is distension and fullness. Clinically, abdominal distension that is warm to touch, constipation with dry stools, bloating after meals, foul smelling gas, and the thirst with the desire for cold drinks. Treatments: stomach 25, stomach 44, large intestine 11, large intestine 4, REN 12, triple burner 6. Hot herbs, Xiao, Cheng Qi Tang, and Da Huang to purge heat from the bowels. Mechanism number 15. All disease accompanied by sound and the drum-like resonance belong to heat. Heat causes the qi in the bowels to expand. When that qi is blocked and rebounds, it produces a sound. Clinically loud borborygmus, that's intestinal rumbling sound. Drum-like resonance when you percuss the abdomen. Gas and flatulence with the heat signs. Mechanism number 17. All contortions and the turbid watery fluid belong to heat. This mechanism gives us a key diagnostic principle about the fluid quality, where mechanism 18, cold, produces clear thin fluid. Heat produces the opposite, turbid, cloudy, dark, thick, and foul-smelling fluid. When heat disturbs the sinews, it causes the twisting and the contortions. Clinically, muscle contortions and twisting movements, turbid, dark, or cloudy urine, turbid vaginal discharge with heat signs, turbid flame, body twisting with fever. And finally, mechanism number 19. All cases of vomiting, sour matter, sudden outpour, and downward pressing belong to heat. This mechanism covers the 2 directions of rebellion simultaneously: upward with the vomiting of a sour bitter matter, and downward with explosive diarrhea with urgency and burning. The key diagnostic sign here is the heat quality throughout, burning sensations, urgency, acid taste, yellow tongue coating. Formulas: 灼金丸 for liver invading stomach with acid, 葛根黄连汤. Now that we've been through all 19 mechanisms, let's talk about how to actually use them clinically. This is the most important practical skill in this entire lecture. The 19 mechanisms are not a checklist. They are a framework for identifying the root pathological nature of any presenting symptom cluster. Here is the 3-step application process. Step 1. Identify the mechanism. Ask yourself what is the root nature of the chief complaint. Is it moving, fast changing, sudden onset? Think wind. Is it contracting, cold, congealing? Think cold. Is it blocked, rebellious, pressing upward or holding back? Think qi. Is it heavy, turbid, sticky, causing swelling? Think damp. Is it blazing upward, disturbing the mind, creating sores? Think fire. Is it expanding, putrefying, making fluid turbid and fall? Think heat. Match the symptom picture to the all X belongs to Y formula and identify which mechanism applies. Step 2. Confirm the organ. The mechanism points you to the root organ system. Confirm this with the pulse, tongue, and additional inquiry. For example, dizziness, wind, and its liver. Confirm, is the pulse wiry? Are the tongue side red? Step 3. Determine the pattern. Within the identified organ system, determine the specific excess or deficiency pattern using standard TSM differentiation. For example, is this liver yang rising or liver blood deficiency creating internal wind? The treatment principle follows from step 3, but the herbs and the acupuncture point should also address the underlying mechanism identified in step 1. One more critical distinction before we move on. Mechanism is not the same as pattern. The mechanism is more fundamental. It tells you this organ system, this pathogen category. The pattern that tells you the specific deficiency or excess state. Always identify the mechanism first. That's your anchor. Then refine with the pattern differentiations. Now for the final and perhaps the most exciting part of this lecture, the connection of Wǔ Yùn Liù Qì. Here is the key insight that many practitioners miss. The 19 disease mechanisms appear in the Sù Wèn Chapter 74. And Chapter 74 is one of the 7 canonical chapters on Wǔ Yùn Liù Qì. That placement is not accidental. The mechanisms are designed to be applied in the context of annual energetic analysis. They are the clinical lens through which the year's energetic patterns are diagnosed and treated. Let me show you what this looks like for 2026. The year Bìng Wǔ. The Da-Un, the central period for 2026 is Sui Tai Guo, water in excess. That activate the cold mechanisms. number 2, and the number 18. Expect more kidney cold and the deficiency cold presentations all year. The 四间之气, the heavenly governing qi, is Xiao in Junhuo, which is an impaired fire. That activate the fire mechanism number 5, 6, 9, 11, and 13 throughout the year. Half fire, Shen disturbance, mania, counterflow. These patterns will be more prevalent in 2026. Stage 3, from late May through late July, we have a double fire. Both the host qi and the guest qi are fire. This means the fire mechanisms 5, 6, 9, 11, and 13 are at the maximum intensity. During those 2 months, in stage 4, late July through to September, we have a double damp earth. Both qi tracks are tying Shu that elevate the damp mechanisms number 4 and the 10 significantly. Expect spleen qi deficiency, edema, heaviness, and digestive dysfunction to peak during this period. And this is exactly how we use the 19 mechanisms in the clinical practice, not just as a standalone reference, but as the diagnostic framework that maps the year's energetic patterns onto the bodies of your patient. For any year, you can build a disease prediction map by cross-referencing the annual Wǔ Yùn Liù Qì analysis with the relevant mechanisms. Fire and heat-dominant years, Zhu Wu, Yin Shen, activate mechanism 5, 6, 9, 11, 12, 13, 15, 16, 17, and 19. Cold dominant years, Chen Shu, activate mechanism 2 and 18. Damped dominant years, Chou Wei, activate mechanism 4 and 10. Wind dominant years, Si Hai, activate mechanism 1 and 14. Dryness dominant years, Mao You, activate mechanism 3. And that brings us to the conclusion. The 19 disease mechanisms are one of the most elegant diagnostic frameworks in all of medicine. In just the 19th statement, Qi Bo gave us a complete map from presenting symptom to root pathological mechanism. 3 things to remember from today. First, symptoms, then mechanisms, then patterns. Never go straight from symptoms to treatment. First, identify the mechanism, the root, then identify the pattern, the specific state, then treat. Second, fire and heat dominate 9 out of 19 mechanisms. That's not random. That reflect the clinical reality that the fire pathology is the most prevalent and the most dangerous in classical TCM. It also reflects the Wǔ Yùn Liù Qì context of Chapter 74. Fire qi dominance appears in many years, and when it does, these 9 mechanisms become your primary clinical tools. Third, cross-reference with the annual Wǔ Yùn Liù Qì analysis. Use the 19 mechanisms as your disease prediction map for each year and season. This is how the ancients intended them to be used, not in isolation, but always in conversation with the year's energetic configurations. If you'd like to go deeper into this material, PDF guide number 7 covers all 19 mechanisms in the full clinical detail, including all acupuncture points and herbal formulas. And if you want to go further with the Wǔ Yùn Liù Qì system as a whole, our full lecture series and the Yunqi Analyzer web app are available at my website. I'm Dr. Sang-Hee Park. Thank you for watching.